So I'm Rick Bemis, and I'm with the K-Square Group. And let me just present myself here. Rick Bemis with the K-Square Group. We're out of Irving, Texas. We're a managed services organization. We provide services to our customers with software accelerators that help you jumpstart your implementations or any type of solution you need in the healthcare space. I'm the Chief Data Officer, and I manage the provider healthcare space for them. What you're about to see is our solution that is an accelerator that helps people get to the right doctor at the right time using the right tools. So if you see this right here, you notice that we have a video that we want to run here. You notice right now what we see here is a typical way of searching for a doctor. So if a patient comes in or a member of your network want to come in, they see 4 different dimensions of information off of this type of directory search. It's really just 3 because we have name searches, we have location searches, and then we have specialty searches. So we're going to show you a specialty search right now. So if I wanted to go out and do a specialty search on oncology, what I would type in is oncology right here, right? And I'd see a list of things that are there. Nice, right? I mean, in the Google days, we thought this was really great. But today, maybe there's a different way of looking at it, right? So we search, and then we start seeing one doctor. And then we scroll, and we continue to scroll. And while you're scrolling, you think about the operational need just sitting there. Somebody just needs to do some work, and they're just sitting here scrolling. They don't really get visibility into what this doctor does. In my mind, it's jumping from a request to detail right away. And in some sense, that's a little bit of a problem because do I know what I'm looking for? I look for oncologists, but do I know the type of oncologist, the group, the specialty, the subspecialties? No, I just get this constant scrolling. And so here I am, waiting, right? Not sure that I'm getting to the right place at the right time. And even if I pick one of these doctors, they may not be the right doctor. I mean, we may have to redo our search. So we want to fix that. We want to provide for you. Let me see. Oh, well, that's the wrong direction. So let's summarize, right? Here's our search screen. Here's the list based on our search. Not very practical in my mind. Wouldn't you rather see this? So how about an interactive model that displays summaries right up front based on your initial search criteria, okay? Now, if I'm in IT operations and I'm trying to, in provider operations, trying to find the right doctor, I could be a nurse practitioner, a credentialer, even a clerk working for somebody, working for the chief medical officer. I get visibility right away. I don't have to run to IT to get a report, wait 2 days because I had to put a request in and come back and then run this report. I get it right here. I can see right here, sports medicine, I got 46 providers there. What do we have here? Hematology, oncology. I've got somebody with leukemia. I need to get to that kind of doctor. I have an anesthesiologist, 228, right up front. So instead of seeing the one thing, I see multiples right here as a summation. Well, I keep hitting the wrong button, don't I? So how do we do that, right? We take slivers of the data. We do it by dimensions. First is the readiness criteria on the information, provider data management in a network. Then we look at the capabilities, the dimensions you see right there on the screen with the actual doctors that support that. And then I see the knowledge, skill, and ability. I go deeper into the semantic. Notice that's what we do here. We click on here to here to here, and we go through this process to get to the right doctor. In this case, it's a PCP. Okay, so there's a lot of different ways of getting around to find doctors, and this is the way we think is more efficient and effective. You bypass a lot of administration needs. You're able to get to the right place at the right time using this type of architecture. So let's do a compare on it. Oh, darn. They got the right button going backwards and the left button going forward. So, excuse me. Please, I apologize. So let's compare now, okay? I think some folks, we were talking earlier about being able to get the right person based on a particular need for ambulatory services, right? Well, in this case, we're just doing oncology, but you can see the first thing you would see in our utility is this. The first thing you see in a search facility in a typical provider directory is this. Which one do you think actually gives you more visibility? I know, this is kind of a funny question, but look at it. This is the actual thing. Look, I got an association with a nurse practitioner here. So if I need to make somebody ambulatory, I might need that nurse practitioner. I also have oncology in many different areas. The physician associations based on that. And I see them right here. I don't have to go through this. Scrolling through this is only going to get me one skill without the understanding of all the people within that skill, what's available for me, right? We give that to you right off the top. Let's go into more detail, okay? Now we're expanding it. We're expanding it to be able to see how internal medicine would have multiple oncologies around that, okay? And look, I mean, you can see one doctor, or you can see an expanded area of all the doctors here, okay? So look at that. We've got 683 in this particular network. We have radio oncologists there that are 338, and so on. Multiple physicians with little scrolling. We see it right off the top. I don't know about you, man, but I'd much rather kind of be able to get to this level of understanding than having to see a single list and going through that. So this is our home screen of our tool. This gives you 4 dimensions of data right off the bat. You have by physician, by skill, by location, and by insurance company. Off the top, right there. Now, you notice this little thing over here, the Provider Genie, okay? When you click on this, the Genie comes up, and it's interactive. It'll run the report even without clicking these buttons, and you can see where you're going. Now, let's do a demo. This is the actual Genie running on a video where we're staying with the process of oncology. So again, the 4 dimensions of data based on those slivers that we were talking about. Each sliver is a dimension, okay? So now let's tick by skill. Now we're in Los Angeles, but let's get all of California. What you see here are all the encounters and the taxonomies, the top 10 taxonomies that are in encounters today. So let's go to cancer. Here we go. Now what you get, the first thing off the bat, after you've gone and selected your skill, is you get this representation. You get ambulatory care. Now you can see all the different taxonomies that associate to this. The classifications, the subtypes, and the specialties. And we can also do configured specialties if you want to. But look at here. Now we have radiology. We have all these different, so we have one underneath here for surgical oncology. When we strike that one, we have 59 doctors underneath there. Now let's expand that. Would you rather see the list or this? To me, this is way better than a list. This is how we think, okay? Now, if you want more to look at, we scroll through this. You can hit the next 15. It'll automatically populate the next 15, right? So here we go. There's the next 15. Not only do we have that, we also can show you a facility associated. But let's look at the detail of the doctor right here. Check that out, right? So now you give the detail of the physician right off the bat, okay? And we can also show you a facility, too. So I think to your question earlier today, you know, what kind of facility would you need to move? What kind of associations to that facility do you have when you want to make somebody ambulatory, right? We can show that. Now, right here, we go to a map view, which gives you a list. So that list will take you into a particular doctor within this regional area. And for this example, let's go to the City of Hope and find an oncologist at the City of Hope. It pulls that right in. There you go. Here we are. So we have this save button that allows you to save the information and download it into a list if you need to, if you want more, right? So here we are. Now let's get the Genie involved here. So we want to find a doctor. So we click on this, and we're going to stay with the subject of specialty, but we also have symptoms we can do. We can do by direct MPI if we want to. So if I've got depression, I can bring back psychologists or psychiatrists that I need, right? If I got sore feet, I can bring back a neuropathist. But in this case, let's look at oncologist again and stay with that. Now, what kind of oncologist? Let's stay with surgical oncology since we've been on that subject for this presentation. Look at there. There I have all the different oncologists right here that I can deal with, and I can select any one I want to at any time I need. To do this and ask your IT department to bring you back a report on this is just absolutely maddening sometimes. You won't get it for days, sometimes weeks in some case. But look at, here's surgical oncology. Let's look at a particular network, LA Care. Okay, now we have LA Care there. So let's look in the LA Care network. What do we have there? Surgical oncology, 58 of them. There you go, right? So now let's say, let's do it by language. Let's do a language search this time. One of the most unique languages in Spanish is Catalonian Spanish, right? So now we go to Catalonian Spanish. And here we have 6 doctors that speak that specific Spanish. How cool is this, right? Now you're culturally aligning your members and your patients to these types of needs. And look at, there they are. I can see the detail right here. When I want to see the detail, I don't want too much detail up front. Why should I have that? I can see the detail now. Now, let's look for primary care physicians. Now, primary care physicians could go across any taxonomy. All the doctor do is to say, I'm a primary care physician, mark me as that. So now what we have is the ability to look at all the different types of taxonomies that are associated with people who want to be primary care physicians. And we come back with a particular star schema with all the primary care physicians right here. So imagine trying to get to this just through your IT department, going through different reports and those types. So let's say we want to reduce the scope to family medicine and general practice. Now we've reduced our search very quickly to general practice and family medicine. Now we can expand this and see what we have. Here's your doctors. Here's the detail of the doctors right off the bat. Look at that, right there. You can see where they are. Again, operationally, how long does this take for your IT department to react to this? Tremendous amount of time. And then what do we have here? We have the ability now to still see them, and I won't bother zooming in because it's pretty much the same thing, right? So what have we done? What have we done? We have given you a 360-degree ability to search for a doctor and find the right doctor for your needs, right there on the fly, without getting your IT department in, without having to go through special requests, and to get to the specialties and the subspecialties that you want. We also can put this in a subspecialty that's not even defined yet. If somebody like street medicine comes, it's a big deal, street medicine in LA County now, because of the homeless problem that we have there. So if you have a skill that's a little bit separate, that cascades it down to a particular place, we can map that into our data. So we navigate your provider searches to examine associations out of network providers. We also have all the networks you need. We got 5 different payer networks we pull in. We pull in all NPES data. We include NUCC for taxonomy updates. And we also take in those 5 directories and put them in our tool. We also take, we're in the process right now of pulling in claims data based on pharmacy needs. And so we'll have the ability to map those in and figure out from a valuation perspective what's going on. Customers can augment their current systems in a more robust view, in a more robust way. How tough is that to see that list and scroll down that list? It's very hard. You don't get to the right doctor at the right time. It accelerates and simplifies visibility into complex networks. The reason why it takes so long for your IT department to come back to you is because they got to do complex queries. They got to do complex searches. They got to go to multiple places. We consolidate that in one single database that we can do very easily. We can do it within a week's time. The Provider Genie gives us a visualization of fast search capabilities into those complex areas. In other words, we can ask the Provider Genie, the AI, to go out and ask those questions. If you ask my Genie that does a turnip need nude surgery, it'll say, we don't do turnips. You know, it'll only say that you can only do it for what we try to accomplish. The accelerator brings together many provider data sources. Not only can we bring outside provider sources for primary source validations to make sure the data is accurate, we can take in multiple sources within your IT ecosystem and network into a single place. We power it with Databricks, which is a highly powerful data management system that allows you to put petabytes of data within your database. We take industry standards, right? NUCC, NPES. We go against the licensing boards. We go against Health and Human Services, and we pull this data in, and we consolidate and curate it on the fly. You don't have to go through all that rigid data structuring that happens out there. You just suck it in. We get this into our database, and then we just go ahead and curate it on touch, which is fast because the technologies are there to do this, right? We should apply this technology to what we do. So that's kind of a summation of what 360 means to us. So how do we support the operations? Visibility in the provider network is not limited to lists. Summary of how doctors are available for their skill sets, on-the-fly details. Multiple data dimensions that are brought together in a single view. Provider directories from multiple payers allow visibility into network adequacy. So if you need something out of network or in network, we show it to you. You can go out and campaign for those doctors to come into your network too, if you don't see them there. 360-degree look at physicians, facilities, mid-levels, ancillary providers. We bring it all together. Not only just from a doctor perspective, but from a nurse practitioner, an ancillary that supplies supplies to people, and so on. Have supply from people, and so on. It just promotes better data governance. Right? So when you're governing your information around your directory, you can govern it using this tool. Okay? Well, that's it for me. Here's my contact information, and you can scan this if you want to get through to us or anything. But I want to thank you. If you guys have any questions, I'm willing to answer some. So, any questions? Yes? Yeah, we use that as our front-end report mechanism, as Power BI. Yeah, and Databricks is our underlying database manager. Yeah, yeah. The semantic? Yeah, the fact that the lists were just too limiting. It just doesn't allow you to see the depth of what you have. And I actually, when I was working for Navy Medicine, devised this for them for other ways so that they could see it, right? And if you think about it, I mean, I've been into semantic graph modeling for a long time, and I think it's great. You know, it's kind of the new age thing, and you know, all that SQL stuff is good, but we see that for more compliance reporting, you know, so you can kind of structure your data. But when you're looking at unstructured data, multiple structures of data, highly disparate, we get away from all that data architecture work that has to come up front. You know, we can just get right to your problem, right to your data, and frankly, we use metadata to curate everything, right? So we know where it comes from, what the particular time is, who's the last update, last modified user, the source, all of that. We can tell it right there. So Power BI has been very powerful for us on the reporting side. And then we can produce a list in multiple ways. We can give you a CVS file, we can give you, you know, an Excel spreadsheet and so on. Yeah, does that answer your questions? Or? Yeah, cool. So is there any other questions? Anybody got anything else? All right, well, thank you very much, guys. I really appreciate attending this talk, and we look forward to seeing you at, with our Provider Genie. Okay, thank you.